Hi, today I'm going to talk about the contraindications in peptic ulcer patient, particularly what you shouldn't take if you're a peptic ulcer patient or has had a recent history of peptic ulcer. And I'm doing this video because of the observations that I have made. About 80% of all patients initially diagnosed with peptic ulcer that I have considered or know little about what they shouldn't take. Their doctors never had the time to tell them about the contraindications of peptic ulcer, and they keep taking things that make the situation worse and don't have a clue about it. An ulcer is simply a wound. When we talk about a peptic ulcer, it is a wound or sore in the GIT, and there are mainly two types, that is the gastric ulcer and the duodenal ulcer, and there are less common types of peptic ulcer as well. But some of the symptoms or signs you will experience include abdominal pain, back pain, heartburns, chest pain, palpitations, nausea, diarrhea, and headache. And if you have been diagnosed with peptic ulcer, the first on the list to avoid, or the number one contraindication, is beans. Beans produce gas, and the gas lowers the pain threshold of the inflamed tissue and make the wound fresh, never healing and worsening the abdominal pain. Number two on the list is milk and its products. The proteins and the fat in milk irritate the inflamed tissue and makes the symptom worse. I would also advise you avoid egg yolk, cheese, and butter. The third on the list is pepper and spices. They burn the wound and lessen the healing process. Think of you having a sore on your skin and adding or pouring pepper on it. It's going to make the thing worse. So just imagine you having a sore in your GIT and taking pepper or spices on top of that. It will make the situation worse. The fourth on the list is NSAIDs, that is non-steroidal anti-inflammatory drugs such as the aspirin, the Motrin, the Advil, ibuprofen, and Aleve. Paracetamol is okay for you if you have a peptic ulcer. Then the next on the list is alcohol and smoking. They increase the pain and slows down the healing process. The sixth on the list is acidic fruits such as the pineapples, especially oranges, lemon, lime, and mango. Imagine you pouring an acid on your skin. It's going to burn you, right? So the acid in this acidic fruits does the same thing to your ulcer and your GIT and makes the situation worse. The seventh on the list is carbonated drinks, energy drinks, or caffeine drinks. The caffeine and the gas produced by these drinks irritate the ulcer and makes the symptoms worse. So these are the major irritants or major contraindications when it comes to what you take that makes your situation worse in terms of peptic ulcer. There are other less irritants of peptic ulcer, and the way to know them is to observe when you experience these symptoms and what you took, that is in terms of the food or drink prior to those symptoms, and then avoid them. When you avoid what we just shared, you will quickly treat your ulcer with the medication you are taking for the ulcer and possibly avoid a reoccurrence of the peptic ulcer. If you want to know the best vegetable to treat a peptic ulcer, I'll put the link right here. Check it out. Hey, always remember that God wants you healthy. Your health, your life.